It's another week and a brand new, very informative episode here on the Granny Panty podcast. I'm your host, RubyLynne, and I am so excited that you chose to tune in today. If you'd like to follow me, you can go to RubyLynne, RubyLynne.com, where you'll find all things Ruby. If you'd like to follow the podcast and sign up for the newsletter, you can go to thegrannypantypodcast.com, where you'll also be able to see all the episodes. You can find this podcast on YouTube, Spotify, Google Podcast, Apple Podcast, and the list goes on. Anywhere that you want to listen to a podcast, you can find us. This week's guest is amazing. He had a dream to start a local clinic where he can serve the population that sometimes couldn't afford to seek regular medical treatment or maybe didn't have insurance. And then that just grew to providing STI testing for the adult industry. He has quite a story and he is very inspirational. I'm excited to talk to him about the process for the adult industry and his community. So help me welcome Taurus with MPOWERR. I am so excited to have you on the podcast this week, Taurus from MPOWERR out of Atlanta. I have been excited to have used your talent testing services the last couple times that I was about to head off to some events. And I just wanted to have you on to talk about the service that you provide, because for some of us that live in very small areas or more of not living in the big metropolis of the adult industry, this service has just been, it's changed my life because I'm not having to search for a bunch of different labs and that kind of thing. So I want to start off and have you introduce yourself and tell us about your background.
Great. Thank you so much. Thank you so much, Ruby. Thank you for having me once again. I'm very excited to be able to partake in this discussion and conversation with you and be a part of your podcast. So once again, thank you for inviting me. Everybody, hello, everyone. My name is Taurus. I am the owner of MPOWERR Health and Wellness. MPOWERR, which is a nonprofit healthcare organization that started as a community service organization when I was back in college. And me and a few guys from the area would go to clubs and bars and pass out condoms and safer sex kits. And that is really how I got my start in public health. I was working for a nonprofit agency at the time, and we were looking at ways to increase STI testing, increase condom usage back at that, and that was around 2006, 2007, to increase condom usage amongst the college students that were in the area of North Florida, where I attended Florida A&M University. And also just because we knew that populations in a certain area, whether they were segregated by specific geological locations or geographical locations, or segregated as the college students being mainly on campus, away from home, whatever the case may be. At some point in time, that college student population intersects with the locals.
Right.
And one thing we knew that one thing we knew was a constant was that college students were going to find the opportunity to have sex. And one of the things I wanted to do, and some of my mentors kind of instilled in me, is how do you reach them without making them run away? And that was because I wasn't too far removed from a college student myself, because I think my college career was longer than a lot of things that had happened in my lifetime, just because me just trying to find where I wanted to go and where I fit in and what my purpose was, learning lessons, life lessons.
Right.
So when MPOWERR started, it started as a community service organization that stood for Men Educating Ourselves with Educated Risk Reduction. And that is how we got MPOWERR. That's what the acronym stands for. So I love when people try to read it for the first time, they're like, M. I'm like, power. Go ahead, say it. Power with two R's. And then I also, it's a conversation starter. It allows me to be able
Yes.
to share a little bit of myself and my vision. So fast forwarding things after, doing the work in the area at Florida A&M University with some of the college students and the local population. life for me ended in that area or at that time of life, and I moved to Atlanta. And I got on with one of the local county health departments under a CDC grant. Under a CDC grant, and doing that work, county public health, and the county government for a while. It allowed me to get some of the experience that I needed to know about how things happen in Atlanta to find out where Empower would be able to put his hands in and be a great fit. One of the things that I wanted to make sure that was a piece of that fit and a piece of that puzzle was the adult industry. Because we had a lot of people come into a lot of the various organizations that I've worked at and provided a lot of their personal information about sex partners, number of sex partners, whether they were at the time we called them survival sex workers or casual sex workers. And the response that they were met with was, long, huge pauses for the worker to try to figure out the right thing to say,
Right.
or no pause at all, and the worker just providing the response that naturally came to them, which a lot of times was a facial expression of disgust or judgment. And in my mind, it doesn't matter what they were coming to receive services for. Our job as healthcare providers are to be a non-judgmental healthcare professional and not the moral character police. So I knew that my journey would be a little different in public health because I was designed to stand out. I was designed to be different. I was designed to meet people where they are so that I could help bridge some of those gaps of whatever they may be needing, at that time as it pertained to health and wellness. Just so
Mhm.
happened infectious disease and sexual health kind of grabbed me and didn't let go. I was supposed to be I was supposed to be a dolphin trainer. And if I and when the dolphin trainer went out of the window, I wanted to be an OBGYN. But a lot of things happened, and this is where I am. And like I say, infectious disease and sexual health grabbed me by the coattails and didn't let go. And that was what I feel like I was designed to do, and that was to make connections with people, make sure that people understood that what a healthy healthcare visit should feel like or what it should look like.
Right. Right.
Um, Regardless of what the healthcare professionals' personal beliefs are,
Mhm.
that's not the environment to impose our personal beliefs. We're
Correct.
supposed to provide
Correct.
quality, effective, and efficient healthcare services to all people.
I love
So
that.
then came Empower, and that's kind of how we got started. I filed for the business back in 2016.
Okay.
Um, Back in 2016, and I was still working for the entity that I was working for at the time, but I knew that my time there was growing short because my vision and my mission was to get Empower as a healthcare organization off the ground. And
Gotcha.
we are now 3 years later in the physical location, with all of my blood, sweat, and tears all over the walls, literally, literally.
You
So
put in a lot of work. I know just from using your services, it's, you're pretty much a one-man show there.
yeah, I mean, and some days I like the silence of just being able to do my job with no interruption. But I'm also somewhat a people person, and sometimes I need other people around me. So those are times when um, I love having other staff around. We have volunteers that come in to help out throughout the
Oh,
clinic.
nice.
Um, and then we have, of course, our medical director and an ARNP. So we are operating at the best of our ability to our capacity at this point in time with the introduction of becoming PASS certified and people now trusting our process, and us being able to provide testing to people that did not have access to PASS certified testing in their area. And that was my main goal when opening Empower, was to become a PASS certified testing facility. I think I put that in motion day one that I got the keys to the building, saying our short term goal is to become PASS certified. So I reached out to PASS. At that time, Ian had not been in the position that he is in now. He was
Mhm.
coming into that position. I started with the guy that was there before him to get the ball rolling. When Ian came aboard, he kind of finally sealed the deal after having some conversations with him. He then vetted our testing process, which means he wanted to make sure before we give Empower the green light, we need to make sure that you guys are testing to the efficiency and proficiency of the services that we currently have available. So, showing him what our testing algorithm looks like for people that are walking in, asking for the exact same panel that we know to be the industry standard panel.
Mhm.
And
Mhm.
once that was combed through, bypassed like a fine tooth comb, they then went ahead and granted us, pass certification once we agree to make sure that we don't do any changes to the testing protocol or to the adult past performer panel.
Right.
And we offer it just as what was approved. So we made that agreement and to be open and forthcoming with pass and participate in pass. So that made a big difference for me in level of accomplishment to
Okay.
actually do something that at first I did not think was even possible. So we've come a long way. I've definitely don't pat myself on the back much. So I guess I can do that with where we are now, but
Definitely
definitely
do
lose
that.
sight of where we want to be.
Yeah, a couple things. I kind of rewinding a bit. I know when I first became aware of Empower was really in January when the chlamydia outbreak happened and the swabbing and then some testing facilities being pass certified and not and that kind of thing. And kept seeing you be tagged or you were responding, I think, to some of that. And I became aware of you and found out that this can be done, mail order. But, secondly, I know that you and I connected really on a different level, not just as clinic and adult creator, but because of our backgrounds in public health. And so that's another reason I wanted to have you on. And so you've been in your physical location for 3 years.
We just
You
celebrated 3 years. Yes.
That is amazing. Tell me how many walk-ins or how many physical patients actually come to your clinic on average per week or per day?
So because we are a walk-in nonprofit healthcare clinic, we are designed to service the community. No one, anyone from any walk of life that needs healthcare services that we provide walk in. So we start the day at about 9 o'clock in the morning. We get our lunch break in midday, and then we keep going until about 5 o'clock. We had extended hours, but those have been cut short because the demand for evening clinic, wasn't as sought after as we thought it would be. So on a daily basis, we could see anywhere from no patients to about 20 to 30 patients a day, and that is a mixture. That is a and I reference patients because that is a mixture of the those in the AFI that we service, and also just general members of the community that are coming in for sexual health screenings, chronic care disease management, or any other type of linkage service that we can link them to that they may not be able to have access to or may not understand how to navigate that linkage process, be it to mental health, substance abuse, GYN services, things of that nature. So our long term goal is to be a one stop shop for those people that don't have insurance, underinsured, or may have insurance and just like the service delivery that we provide.
Mhm, mhm. Awesome. And are you some people who might be watching this won't know this term, but you will. Are you a federally qualified health center?
We are not FQHC just yet. That is
Okay.
a totally different beast that I have been looking at that application since day one.
I
It's
used to
one of the
manage
things
an
that,
FQHC, so I was like, some
yeah,
people watching this won't know, but you'll know.
it's one of those things and it has its benefits, but also just kind of where we are as a baby healthcare organization,
Mhm.
making sure that we are operating as a well-oiled machine is my first part, my primary and main priority. To making sure that everything is has been combed through with a fine tooth comb to make sure that we are operating at our top notch, and then we will look into some possibly FQHC journeys or whatever the case may be, or if we may just want to decide to stay as a nonprofit entity.
Right.
Um, and
It's a
and and
lot of work being a federally qualified health center and a
yeah,
lot of hoops and paperwork and
and I'm not big on people coming into my business telling me what I
right,
need to do. That is one of the reasons why I enjoy working for myself because I am my own boss. Um,
right.
my board, I definitely report to my board. My board has been a blessing for me, but just being able to sit in this seat of
Mhm,
many hats and just be able to be happy with what I do as a career,
mhm, mhm.
and no longer dreading, oh, I got to go to work today. Is it a holiday?
That's
It's one of
right.
those kind of situations. So,
That's right.
yeah.
Tell me about the ongoing pass certification. So, what is your do you have yearly requirements to remain pass certified? Do you provide them with specific reports? Do you keep like epidemiology? Tell me about what it takes to be a pass certified provider.
Well, so to my knowledge, that would probably more of a past question that's directly addressed to past because that is something that I don't really know the answer to. I just shot my shot. I just shot my
Gotcha.
shot as a independent healthcare nonprofit organization that has the years of experience in sexual health, STI specifically.
Mhm.
And I knew that I wanted to be able to provide testing to the adult filming industry, just because I had met a few adult film performers that um, my public health hat is automatically put on anytime I have any type of conversation with anybody about sex or about just sexual health and awareness, just because of where we are now in 2023. We're no longer where we were 30 years ago, where STIs and HIV and all those type of things had that heavy burden of stigma. So because of where we are, I'm always in educator mode. I'm always trying to make sure that people have as much of updated information on public health, STIs, HIV as possible, so that we can continue to kind of debunk a lot of the stigma and myths that
Stigma.
people still have about STIs and HIV. And because we have sex, we know that that comes along with the territory.
Right.
If we don't do all that we can to prevent exposure or to
Mhm.
prevent infection,
Mhm.
I think that it was after speaking with Ian a few times and just letting him know who I was and
Mhm.
what my background was and what we were able to do, because we were already testing content creators and
Right.
even some mainstream adult film performers. We were already providing healthcare services to them,
Mhm.
and a lot
Right.
of them had things like health insurance, but because they had been testing under the current operations for so long, the thought of being able to use health insurance for that panel was not even a question that they would ask anymore. And I'm like, hey, do you have health insurance? And they're like, yes. I'm like, you're paying for health insurance. You should be able to use your health insurance for these health assessments that are being provided to you. So, just being able to, I think just being able to have a conversation with Pass and Ian and being able to let them know that, we will respect the guidelines that Pass set out for us if you bring us aboard, but this is what we can add. And we want people to not be in a situation where they're forced to make a ethical or moral decision when it comes to testing. We need them to have options. So if
That's
where I am currently at the moment says that I can only afford or I only have $50, but I need to get tested so that I can make my next shoot or whatever the case may be. If there's an
Mhm.
option for me that's past certified for me to be able to do that, to get me to the
Mhm.
next step, I'm no longer faced with what do I do because I can't test, or
Right.
what do I do because
Right.
I may miss out on my check to pay my rent because I can't work or whatever the case may be. So just being able to provide talent with options, that was first and foremost. Provide people with options, because
That's great.
I can't really say what's best for you financially. I can't count people's pockets. All I can do is say this is what we have to offer. Will it help you? And that's
That's
kind of
awesome.
what our message has been. We're just here to help. I'm just here to help.
And you are very helpful. So now let's talk about the process. If someone wants to get tested with you, walk us through. I mean, I personally know the process, but I want you to explain it and let people know just how easy it is. So tell us what the first step. They go to your website, they check it out, they see they want to order the full panel, pass certified panel. So walk us through that.
So, thanks to my wonderful IT guy, who I know there's times when he wants to probably just run me off a cliff, because my whole thing is the site has to be accessible, the site has to be user friendly, and the site has to work at the drop of a dime when people need to log in to see their test results for whatever that reason may be. So now that we have a new homepage or a new just a new initial branding look or feel when you go to the
Mhm.
website, which is www.empowerhwa.org. It brings this nice vibrant page, and you are now able to see exactly what it is. If you are a member of the AFI and you need pass certified testing and you're outside of the Atlanta area, you clearly can read those options to say, hey, I'm in Kalamazoo, I need to order this test and I need to have it mailed to me because I'm not able to walk in. The instructions now are clear and concise that you click here if you need a mail order test. Mail order means we're going to ship the swabs to you. You will self collect, and then you will take them to our partnering laboratory, LabCorp, to have your labs completed. And once we get those results, we upload them to your confidential electronic Empower portal. If you want to walk in, you'll do the exact same thing. You'll go to the website and you will make an appointment to come in, or you can make an appointment to come in as you can schedule a time to come in as a walk-in. But because we are short-staffed, I work better knowing that someone's coming in versus people
Mhm.
just walking in. Um,
Mhm.
but you can do either. Everybody, my phone rings day in, day out, sun up, sun down, because I initially made the. I don't know if it was a mistake or if I was just I was high on the attention and the momentum that I gave out the mobile number that I had to transition to a work phone. And that phone rings and messages ding nonstop, which I
I
don't
bet.
mind. I don't mind, but you can also send us a text message or an email to schedule if you still just have a problem navigating the website. At some point in time, some people tell me that I'm a little too people friendly. That's why my phone rings so much. But I'm like, I want people to call. I would rather you call and wake me up out of a dead sleep than be there trying to get into the site or order a
Right.
test and you miss something that's important to you. That's why I'm here. So yeah, you've got multiple ways. You can schedule the test online. You can give us a call at the office number, which is 770-742-0813. That is our landline number, or the trusty mobile number that is always attached to my side, which is 470-875-8476. Somebody's going to get it, either myself who may be working in the clinic that day or volunteering that day. Somebody's going to get that information, and we will do our best to get back to that person as soon as possible. So that website should have made it very, very, very much more easier for people to navigate to order their testing. Um,
Definitely.
yeah, so I mean, we're just here, just trying to be of service. That's all. I don't. A lot of people ask if I want multiple centers of Empower opened up.
That was on my
Around
question list. You're nailing all my questions here. This is
Ruby.
awesome.
It would be a great thing to happen as long as I have the infrastructure and manpower to not water down the services that we provide. A lot of this comes with a lot of overhead. And if you don't have the funding to support it so that you can feel comfortable waking up and going to sleep every night, not worried about what's going to get paid and what's not going to get paid,
Right.
by all means. But running a healthcare establishment is one entity. Running or owning a laboratory that has the capacity to output the amount of tests that would be coming into one facility, it comes with a huge price tag, because you've got to pay the staff that are trained and certified or licensed enough to run those type of testing with the testing technology and the educational background to be able to do so. And like I tell a lot of people, it's not a small number. And
No,
it's not a small number at all. A lot of talents like, well, what can we do to get you to open up a laboratory? I say a laboratory and a small walk-in collection site are two totally different things.
that's right.
Laboratory is coming with at least a half a mil to close to $1 million price tag when you want to run it effectively and efficiently.
I
Um,
bet. I am gonna rewind just a little bit though. So I go online and I go to the website or I call, I order the test, and then you mail the lab orders and the swab collection kit out to the the patient.
Correct. So when you want the swabs shipped out to you, we normally ship in about a 2-day time period. So if we were to ship them out today, you would get them, today's Wednesday, you would get them about Friday. And we ship via FedEx. So as long as FedEx is operating, there's no strange weather or whatever the case may be, then the plane should fly. And if there's a possibility for us to get the kits to you a lot faster than that, we will choose that faster option. Shipping is normally tacked on to all of the mail order test kits at about $25. It costs more than $25 to ship that. We just eat the rest of the cost to kind of help with the shipping. So we're only until we need to increase the shipping cost, we'll leave it at where it is. So say you're ordering the mail order test kit and you have insurance that will cover your testing. You will only pay $85 when the ships first when you get your kits for the first test. You'll pay
Oh,
$85, and then you have your second kit already ready to go when it's time for you to test again. That test is $50. That's if you have insurance, and your insurance will take care of those labs.
I'm gonna
Um,
try running it through my insurance next time. I haven't the last couple times, and I don't. I don't know, I got
Yeah,
was
it can
it
be
was
it can
down
be
to the
kind of
wire and
yeah, it can be kind of messy for some people depending on the type of insurance policy that they have. That's why
right,
I want everybody to, if you're paying for the insurance policy, try to get as well acclimated to what you're paying for and the benefits instead of just carrying the insurance card and when you need it, you can't use it.
right,
Um,
right.
but yeah, so we'll ship the swabs out in about 2 days. Now, once the person gets the kit, whether you're using the insurance or you're paying full price, that full price is our testing is 185 plus shipping costs, which is
Mhm,
adds on the $20 or the $25, and you're paying about 205, and that covers the shipping of the kits to get to you and your first test. The second test you pay a flat 185 for because you already have the
okay,
kit in your possession. You already have the kit and the swabs in your possession. You have everything that you need to collect with us, and then you go to LabCorp, and they will collect your urine and your blood work to complete the panel. And once we get it, we upload it to your Empower portal, and you're able to log on, share your results. You're also able to check and pass because we put your information. We will put your clear to work availability or not clear to work availability into pass,
perfect.
and
And
that's
when
what.
you and sorry, I
I'm
didn't
sorry.
mean to interrupt you, but when you receive the swabs, we do need to schedule a telehealth with you though to collect the swab samples.
Well, so what you yes, you will need to schedule a
Mhm,
time to do a remote, what we call is remote procedure monitoring, or just monitoring you collect the swab, and make sure that you collect it correctly and
mhm,
it's sealed correctly so that you can take it to the lab.
mhm.
And when we first started this process, this started as a pilot, and in house it is still a pilot because we are still working through kinks of this program. For most people, it's been working wonders. For some people, it doesn't work as fast as we would like it to. What we do know to kind of work out in a lot of people's favor is to test earlier in the week. So if you have time to plan your testing and plan your shoots, it's a lot easier to test on a Monday, Tuesday, Wednesday and have those results back in about a 24 to 72-hour time versus testing on a Thursday, Friday where they may get lost in the weekend. But also we do have some, results that come back, sooner than we expected. And we're like, oh great, let's get them out as soon as we can possibly can. But it's just our services is probably for more so for those for talent and creators that are planning their work, or planning
Yes.
the use of the test, because you do have that period where you may not get your results back for about 2 days, 48 hours, or at the most, 72 hours
Mhm.
depending on where you are geographically located. Um, our LabCorp kind of produces or turns around those results at different timings. So some people may get them back in 24 hours. Some people may have to wait that 48 hours, or in a lot of extreme cases, that third day. One of the things we kind of make sure that we do is communicate with people throughout that process. So you're just not going to your phone every 15 minutes waiting for labs to post, waiting for labs to post. I'll give you a call and say, hey, this is TJ. Let me tell you what's going on. I'm still waiting for XYZ to post. Or I'll call and give people a heads up. Hey, all of these are done. We're just waiting on this lab to post. And as soon as they get posted, they'll be uploaded to your portal and you're good to go. I think that level of communication and commitment to showing that we care helps people. It kind of eases a lot of their angst. But with any business, there are going to be some ups and downs and some hiccups as far as things that we can't control, like shipping issues, things that happen in the laboratory where the test panel may need to be run again. The lab may be short on supplies. That means that test panel can't be run that day. It may have to be run the next day, whatever the case may be. So,
Yes.
yeah, what we want people to understand is that no testing facility is perfect. We all have our things that happen that we just cannot control, but we do, from what I know, we all work to kind of seamlessly and efficiently provide, what people are paying for.
I have been completely impressed, which is why I wanted to have you on. I mean, I have tested mostly on Fridays, I think. I think I've tested once on a Thursday and once on a
You know,
Friday, but have had my results within 48 hours. Even on the weekend, I've gotten my results already. So
and I'm
I'm
always sitting at the
impressed.
computer like this. I'm sitting
I
at the
love
computer. Please come back. Please come back.
and I
it is
love the fact that you can do the swabs at home in the privacy of your own home too, which I like that,
Yeah, I mean,
because
it because definitely depending on the lab that's running the facility, running the test, they will reject the specimen based on the way that it was collected. So if it's not collected properly, if you're collecting the wrong sample from the wrong parts of your mouth, like cheek cells, and some people put the
Mhm.
swab in their mouth and just go to town rubbing their cheek. That's the wrong area, and if it's got the wrong thing on it, they're not going to be able to run the test. They'll reject it or they
Uh-huh.
will, flag it to say that it can't be processed because it's got the wrong thing on it. What we want people to understand is that when they're doing those mouth swabs and those rectal swabs, and they're doing them for themselves, and no clinician or no clinical person is helping physically with that, you want to make
Mhm.
sure that you're either asking for clear instructions as to what you need to collect or the right way
Mhm.
to do it, so that you're not collecting the wrong thing, and then that swab can't
Right.
be processed. Then you have to go through that whole process of retesting again. But
Yeah.
mostly, we had a lot of people, and from what I've heard, testing across all the testing platforms are doing well with the swabbing as far as self
Mhm.
collecting when it's time for them to self collect. But we want to make sure that if people have questions about whatever that process should look like, as far as if they're collecting the right sample or the wrong sample, as
Mhm.
long as the lab hasn't told you that it was an unusable sample, then you're probably doing it correctly. But
Mhm.
if you ever have questions at any health facility, you should always be able to comfortably ask those questions.
Right. Right. Yeah, the whole process has been amazing, and even from the first time that I contacted you and did my test till the second time, which was only a matter of a few weeks, that you had made so many improvements already to the website. I love that you're listening to creators, you listen to people about what is, works for them, and so that's just very impressive.
That's how we make things work. We have to listen to each other. We're no one organization or entity is able to exist without the other party.
Mhm.
If there are no
Mhm.
talent getting tested, who are we testing? If there are no testing facilities to test the talent, where are you getting tested? So we've got to be able to work together. I've always been one that I welcome constructive criticism because I don't know it all. I'm not a perfect establishment. I'm not a perfect person. I'm just a person that's willing to do what I can to make your testing experience a little better, or make it suit for you where you are. And as long as we can continue to do that, we will continue to do so. Uh oh.
It's amazing. Yeah, and you're saving people so much money. I've been pretty verbal about it on Twitter myself, like, saved 100 and something dollars, and when you're my partner and I are both testing at the same time for events, I mean, that can really add up, so
Yes,
thank
yes,
you
it can.
for all that you
We have some
do.
couples that are enjoying that testing together. I mean, it's doing a lot of things for some people that we never thought it would do. That people are finding a sigh of relief or just satisfaction, gratitude with the services or the service delivery. So as long as people are satisfied, we will continue to do what we can to make sure that people have access to what they need.
Awesome. Yeah, I it's amazing. So, what do you think's the biggest challenge that you face right now in your business?
The biggest challenge that any nonprofit faces that does not have a ton of money up front, it
Mhm.
would be money. A lot of nonprofit organizations like Empower start from someone's gut instinct or dream
Mhm.
of making some type of change or providing some type of service to the community to make their lives just the least amount easier. And a lot of times we do that from our own pockets, or we do it from the slightest bit of money that's more than $100, and you're excited. Ooh, now I can get this dream off the road. I mean, off the ground, and things work for you to kind of get from point A to point B, and then you realize point C comes with a really, really huge price tag. Like, how am I going to make that work? Funding is, one of the things that drives the organization's operation. So we're writing grants to bring in more grant funds or more operation expenses to help us continue to provide the services to communities. In-kind donations from people that have the ability to say, "Hey, I've got $1,500 that I can donate to a nonprofit.
Mhm.
How do we
Mhm.
do it?" Those type of donations. We have to fundraise. So fundraising is something that has to be at the forefront of my board's ideas as they are
Mhm.
trying to make sure that they continue to support my dream, making sure that we're making the decisions that have the organization's best interest and longevity at heart. It would be
Okay.
funding to do a lot of the things that we would need: increased marketing, being able to establish our own high complexity laboratory to where we may not have to send out laboratory specimens to other labs to have them run for us. That would, but that, like, once again, like I said, that comes with a really huge price tag. We have to have the funding to put everything in motion so that there are no gaps in service delivery, or there's no drop in the integrity of what we do.
Right, right. Yeah, that is a big challenge. And how do you think the adult industry can help with that? Is there anything that as an industry how can we support it more?
continuing to support through, testing with us,
Okay.
spreading the word to let people know that we may have some of our options may work for them if they're in a service desert in an area
Mhm.
where, funding may be an issue and they have access to a lab core, but they want industry standard testing. Just
Mhm.
a referral goes a long way. But if anybody feels inclined to make a donation, we have a donation link on our website. And once again, we are a nonprofit 501c3 healthcare organization. So everything goes back into the operations of the business.
Awesome.
And like I say, my phone rings all the time. My number's available. Give me a call if you have ideas, if people have ideas or, may have some type of mindset to help with marketing or whatever the case may be. I welcome a lot of different types of help once it's vetted. We had some issues where the site was under some hack attempts or
Oh, right.
spam and malware. So we've had to increase our security. And because when we did the initial spaces that got us the recognition that lasted, thanks to Ebony Mystique and a few of the clients that had already been here, tested Empower and they started messaging me saying, join the spaces. I'm like, what is the spaces? What is the spaces? And I joined. And that's kind of how we got the recognition as to being a new pass certified organization. But just want to make sure that we do everything effectively and efficiently. And as I was stating, we had to kind of up the security because that put us out in the public's eye to have to deal with a lot of things that a lot of the workers in the adult filming industry have to deal with. Emails coming in about, hey, can you make me adult film star? No, I'm not.
Oh, jeez.
I can get you tested. That's about all I can do. I'm more so concerned with your health and wellness. That other journey, you may have to navigate that on your own. That opened us up to a lot of the spam emails and things of that nature. So we had to
Yeah.
kind of increase some security so that we can combat that. But
Gotcha.
other than that, that's how we can. That's how the industry can continue to support us.
Perfect. Thank you for that. Well, I just want to thank you so much. I know you're super busy. I want to honor your time, but thanks for coming on, talking to us about the process. Thank you for having this service that basically it's like testing without borders. I mean, I think of it. It doesn't matter where you live in the U.S. You can get this testing. It's made a big difference in my life, so I appreciate you. But I will definitely link everything below so that creators or non-creators can get in touch with you.
Yes.
And yeah, thank you so
And if we
much.
can help them, we will help them. If we cannot, we will do our best to make sure that we can refer to a service that can. Once again, like I said, the mail order program did start out as a pilot. It is still a pilot here in the office because we're still tabulating data. What works? What's not working? What might we have to change in order to continue to deliver the service? So we're putting all of that information together. And as soon as the program is written in stone and not ever going anywhere, we're definitely going to let everybody know. We hope that we won't have to change too much, but just like with any business, there will be some changes just to make sure that we're doing everything that we should be doing and can be doing legally and ethically is first and foremost, and making sure that everybody's information is safe and that people are comfortable when they use the service. So we welcome all constructive criticism and any type of ideas.
That's amazing. I always say feedback's a gift.
Yeah, it definitely is, especially when it's well thought out. And I'm not trying to decipher if you're upset with me or if you're generally just trying to provide some information.
That's right. Well, thank you again. I wish you guys the best of luck. I will definitely continue to use you, and I'm excited to see your business grow in the
Thank you.
future.
If anybody's in Miami, we will be in we'll be why can't I speak right now? We will be at Exotica Miami. So just stop by the booth, say hello. We're working out some things down there with trying to see what type of services we can provide, if any, but we'll definitely be in the space for people to at least just stop by and say hello.
Perfect. Perfect. That is awesome. We'll have a great Exotica, and I'm sure I'll be talking to you soon.
Thank you, Ruby. Thanks for having me.
You bet.